Hello everyone, welcome to the Pathology of TCM online classroom. We have learned the physiological characteristics of the elderly last lesson. Today, we will introduce pathological and clinical characteristics of the elderly. The pathological characteristics of geriatric diseases mainly include the changeable workplace and hyperactivity, prognosis, and yin-yang during the disease. The first pathological feature of the elderly people is weakness mixed with the hyperactivity. The physiological feature of elderly people is that yin-yang and qi blood are becoming more and more deficient, contributing to their pathological features. For example, attacked by exogenous pathogenic factors since the interstitial space are open. Endogenous impairment due to abnormal changes of the seven emotions with the aging. Endogenous stagnation caused by hyperfunction of the spleen and the stomach, and the diseases caused by deficiency of yin-yang and endogenous pathogenic factors. Deficiency of yang and qi with the hyperfunction of women contributed to the endogenous cold and dampness. With a deficient yin and blood, the body cannot depress excessive yang, producing endogenous heat and fear. Not only the deficiency of yin, yang, and qi blood, but the stimulation of cold, damp, fear, and hot contributed to the pathological feature of health qi deficiency and the pathogenic factors hyperactivity, namely weakness mixed with the hyperactivity. The second pathological feature is much phlegm and stasis. Exogenous pathogen, endogenous impairment, or visceral azoria can cause the stagnation of qi. Qi is stagnation and blood stasis. Liquid accumulation and endogenous phlegm, producing phlegm and blood stasis. In addition, phlegm and blood stasis are vital pathogenic factors. According to the different paths where phlegm and blood stasis occurred, elderly patients may have different symptoms and desire, like headache, dizziness, chest pain, angina, abdominal distension, coughing, wheezing, dementia, forgetfulness, hyponatremia, abdominal mass, black eyes, dry and rough skin like scales, dark lips with blue tongue and tongue-thick coating. The third feature is the sinus disease may evolve fast, with insufficient health qi and visceral azoria. Sinus diseases may evolve stepwise or control stepwise fast, and even producing mutations. The environment from disease to disease, syndrome to syndrome is rapid. Fourth, the elderly people are vulnerable to depletion of yin and yang. Insufficient yin and yang constitute the pathological basis of the depletion of yin and yang in sinus diseases, resulting in sudden death or death. Clinically, the elderly people are more likely to suffer the environment of diseases, and the depletion of yin and yang. All in all, there are four pathological characteristics in cyno diseases. First, weakness mixed with the hyperactivity. Second, fast environment. Third, much stasis and phlegm. Fourth, depletion of yin and yang. These characteristics play a vital role in the development and the prognosis of geriatric diseases. Next, let's learn the clinical features of the geriatric diseases, which is determined by the physiological and the pathological characteristics of the elderly. First, the onset is acute. Most idiopathic diseases closely related to aging are chronic, which shows the characteristics of acute onset and slow development. It's difficult for some patients to identify the symptoms and the time of onset, such as arteriosclerosis and osteoporosis. It's difficult to distinguish some symptoms and the signs of the aging. Some symptoms are often mistaken for natural aging, such as memory loss in the early stage of senile dementia and the frequent urination of prostate hyperplasia. Additionally, some old aging-related diseases, such as the diabetes, hypertension, hyperlipidemia, and the tumors, also shows the characteristics of insidious onset and relatively slowly development. This second clinical feature is the symptoms and signs are atypical. In older age, the body's ability to adapt to changes in the internal and external environment declines, and the ability of resistance to pathogenic factors declines, so that elderly patients often lack typical symptoms and signs, such as senile pneumonia. It can show symptoms of poor appetite, lack of energy, and urinary incontinence without chills, high fever, coffee at the onset. The white blood cell count may also not be sufficiently increased. The third is a combination of multiple diseases, as the hyperfunctions of the vessels of the elderly. One viscous attacked by pathogen can affect the other vessels. Western medicine also believes that the elderly not only have many complications, but also have multiple systemic diseases and even multiple pathological changes in the senile organ. According to the survey, such elderly patients suffer from 3 to 5 diseases. The three major characteristics of the senile disease introduced above will be helpful in your future study and the clinic as long as you achieve mastery. For example, mastering the physiological characteristics of the elderly. The elderly people can correctly understand aging and learn how to maintain health. Mastering the pathological characteristics of geriatric diseases. Doctors can treat and prevent the geriatric diseases accordingly, grasping the clinical features of the geriatric diseases. Doctors can diagnose diseases more accurately and reduce misdiagnosis and misdiagnosis. That's all. Thank you. Bye-bye.